Hi, do you have any elderly men in your house? Are they more than 50 years? Did you ever ask them, are they suffering from urinary problems? Yes, most of the men over 50 years, I mean 50% of men over 50 years are suffering from urinary problems. And most of these urinary problems are caused by benign prostate hypertrophy. What do you mean by benign prostate hypertrophy? So prostate is an exocrine organ which lies below the bladder, which controls the fluid in the seminal fluid, and it also responsible for hormonal secretion and regulation of the urine flow. As the age grows, the prostate size increases and it compresses the prostatic urethra. Urethra is nothing but a small tube through which the urine flows from the bladder. And when this prostate grows in size and compresses the urethra, there are these symptoms which are called as lower urinary tract symptoms. So patient will be having problem in evacuating the bladder. Patient will be having problem in initiating the urine. Patient will be not able to completely evacuate the bladder, so that for that reason he will be getting up multiple times at the night. Most of the patients think that it is because of diabetes. No, it is because of benign prostate hypertrophy. So whenever these elderly people are suffering from these symptoms, we can subject them to a simple test called ultrasound. We do an ultrasound and we can decide whether it is because of benign prostate hypertrophy. Generally, the prostate size will be less than 20 grams, but if it grows in size, then it will cause all these symptoms. So whenever you decide that the patient is suffering from benign prostate hypertrophy, generally urologist gives a lot of medication. So these medications have to be taken for a long time. But once the patient has started taking this medication for a long time, patient comes and complains that he's suffering from vertigo, tachycardia, nausea, headache. So he comes back to the doctor and says that please give us one-time solution rather than taking these medicines and undergoing these adverse effects. So urologists can offer you TURP or otherwise prostatectomy. Both are surgical options. You know that whenever a patient undergoes surgery, they have complications. So there might be blood loss, they might be indwelling Foley's catheter for a long time, they might be dribbling of urine, and even retrograde ejaculation and sexual dysfunction. So if you don't want to undergo surgical options, or you don't want to suffer from these adverse effects, there is a better option called prostate artery embolization. I, Dr. Balaji, Senior Intervention Radiologist, offer you prostate artery embolization for benign prostate hypertrophy. So what is prostate artery embolization? We very well know that any growing organ, even the prostate, requires more blood supply to grow in size. So when you cut down the blood supply to the prostate, automatically the size of the prostate decreases, and whatever pressure symptoms it is causing on the urethra, it will be decreasing. So we do it through femoral or radial. It's a daycare procedure, very minimally invasive, through a small pinhole. There is no cut, there is no scar, there is no suture, there is no need of indwelling Foley's catheter. So once we do prostate artery embolization, the patient will be relieved of all the lower urinary tract symptoms what we spoke about within a span of 1 month. And after 1 month, he will be very much relieved. He doesn't have to take any medication, he has to not undergo any other surgery. So prostate artery embolization, when compared to its alternative, is very effective, and also it influences on the quality of life. As we discussed, if the patient undergoes surgery, the quality of life might be decreased because of indwelling Foley's catheter, sexual dysfunction, retrograde ejaculation. All these adverse effects are not seen in this minimally invasive option, that is prostate artery embolization. So next time, whenever you see any elderly people, please do ask them, are they suffering from urinary problems? If they are suffering from urinary problems, let us do some diagnostic tests to determine that he is suffering from benign prostate hypertrophy. And when we get to know that he is suffering from benign prostate hypertrophy, the best option is prostate artery embolization by intervention radiologist. Thank you very much.